Welcome to the Emergency Center at Children's Hospital of the King's Daughters. Your child is in good hands here. Each year, more than 40,000 children are brought here for emergency care. And even though every child is different, their parents often have similar questions for us. The first question most parents ask is, how long will we have to wait? The answer is, it depends on how sick your child is. In emergency rooms, the sickest patients are seen first. A child who arrives after you, who has a more serious emergency than your child, will be seen before your child. You might notice a child who doesn't look as sick as yours go back sooner to this area of the emergency department. This is the fast track area. The fast track area is kind of like an urgent care center, but it shares a waiting room with the emergency room. If this seems a little confusing, just remember that the staff here is making sure that every child gets the level of care they need. Another question parents often ask is what will happen next? The best way to answer this question is to walk you through the steps of a typical emergency room visit. The first place you'll go is the triage area, where a nurse will examine your child to determine how urgent the problem is. Next, you'll meet with a person who will register your child as a patient. You'll be asked for your address, phone number, an emergency contact person, and insurance information. After your child is registered, you'll spend time in the waiting room until a nurse calls you back to the exam room. The exam room is where you'll meet the nurses, technicians, therapists, and doctors who will take care of your child. Don't worry if you forget their names. You can always identify CHKD employees by the special badges they wear. Here's a quick look at some of the people you may see during your visit. A nurse will probably be the person you see most during your visit. If you have any questions about your child's care, this is the best person to ask. Next, you'll probably meet a resident physician. This is a doctor who is getting advanced training in pediatric emergency medicine. The resident physician works closely with the attending physician. The attending physician is in charge of the emergency center. Sometimes these two doctors may ask other doctors who specialize in your child's specific problem to help too. Having a wide array of pediatric specialists right here is one of the big advantages of bringing your child to CHKD. Any of these three doctors may order tests such as x-rays to help diagnose your child's illness. Technicians who specialize in working with children may administer these tests in the exam room or in an area close by. Seeing different doctors and waiting for test results can sometimes take hours. To make the wait easier, your child can watch a video or play with toys. You may also spend time with a child life specialist while you're here. They help children relax and feel calmer during procedures such as stitches. But we can't forget the most important member of your child's treatment team. That's you, which brings us to the last question parents ask us most often. What can I do to help my child? The best thing you can do is give us specific information about your child and why you're here. We need to know all kinds of things. When did your child's symptoms start? Have you given your child any medication? If so, what kind, how much, and when? Has your child been sleeping, eating, and playing normally? Throwing up? Going to the bathroom a lot? Does your child have a chronic illness we should know about? This sort of information is very, very important. Also, be sure to check with the triage nurse before you give your child anything to eat or drink, especially if they're having tummy problems. Also, let someone know right away if your child suddenly seems much sicker while you're waiting. Before you go home, we'll give you lots of information about how to care for your child when you get home. Please make sure that you understand all of our instructions. If there is something, anything that you don't understand, just ask us, because we're all here to answer your questions and help you and your child feel better.